serve as the structural framework for the functioning of most societies and have a wide range of responsibilities. While there are many types of governments, they are concerned about similar national issues from the economy to education to defense to health. Outside of the government itself, so many other groups influence society. This includes corporations, the media, nonprofits, clinics, lobbying groups, and the people themselves. These groups have a lot of influence, but instead of representing a particular country or state or physical area, they often go beyond borders and represent a set of values or an ideology. As a result, these groups are called non-state actors because they are separate from governments or states. Even though these non-state actors aren't affiliated with, directed by, or funded through the government, they have a lot of power to facilitate change. Keep in mind that a non-state actor in one country may actually be controlled by the government in a different country. However, while non-state actors can be influenced by the government, they still have their own agendas. This can be clearly illustrated through the role played by non-state actors in various social movements. A social movement is when a group of people and/or organizations work towards a common goal. This goal is oriented around social change over a long period of time. Often, the social movement doesn't come from within the government, but rather outside of the government, and this is where the non-state actors come in. Unfortunately, things aren't always straightforward. Sometimes the non-state actor involved is working with the social movement to promote change. Other times, the non-state actor is what the people of a particular social movement are demanding action against. We will look at various examples around the world of both of these cases. The goal of a health reform movement is to change opinions and policies surrounding an aspect of health. These types of movements can include healthcare reform movements, which seek to change part of the healthcare insurance system in a given country, and mental health reform movements, which often seek to end the stigma surrounding mental health. The health reform movement currently ongoing in Canada is focused on the country's opioid crisis. Opioids are highly addictive if taken for a long period of time, and recognizable opioids include fentanyl and morphine. When taken as directed by a doctor and not used for a prolonged period of time, these drugs are helpful for managing pain while injuries heal. However, if taken for too long, a patient can develop a dependency on the drug, leading to addiction and terrible side effects. Opioid addiction is a North American crisis in the 21st century. There were at least 1,035 opioid-related deaths between January and March 2018 in Canada. Canada is struggling with the opioid crisis, and this has resulted in a wide variety of potential solutions being discussed and implemented, from providing more money to public health facilities to more strictly regulating the type and amount of drugs that medical professionals can provide. Arguably, the most controversial of these solutions is a supervised injection site. Supervised injection sites, or SIS, are facilities in which addicts can safely inject themselves with drugs. These facilities provide both sterile equipment to prevent the spread of disease and a system for checking drugs to ensure that they are not laced with something more harmful. These facilities do not provide drugs to people. According to the Government of Canada, the goals of SIS include preventing overdose deaths, reducing the spread of disease from unsafe injection practices, reducing public disorder by providing a space for injection, and providing an entry point for addicts to seek rehabilitation and treatment. Insight, operated in downtown Vancouver, is a well-known SIS. Insight opened in 2003 to provide the community with a safe site for injections, and studies have shown that the model is working. The British Columbia Centre for Excellence in HIV/AIDS showed that among those using Insight, 70% are less likely to share needles, and 30% are more likely to enter detox. The same study also found a 35% reduction of overdose deaths in the neighborhoods surrounding Insight. Overall, up to 1,000 people use Insight facilities in a given day, and while there have been 6,440 overdoses and overdose interventions since 2003, there has not been a single death. Critics of SIS believe that these models encourage unsafe practices and increase public disorder by providing spaces for addicts to congregate. However, the Canadian Supreme Court ruled that drug addiction is an illness and that Canadian citizens have a right to seek treatment at Insight. Another criticism of Insight is its reliance on taxpayer dollars, as it costs $3 million per year to operate. However, Insight has determined that 4 taxpayer dollars are saved for every single dollar spent, since the facility prevents costly overdose treatments. Canada has seen other models for healthcare regarding opioid use as well. For example, the Crosstown Clinic provides medical-grade prescription opioids in a safe environment. This is different than Insight, which doesn't provide any drugs to its patients. Opioid use wasn't really thought to be addictive until the 1980s, but even after that, Large pharmaceutical companies like Purdue Pharma continue to release opioid drugs and advertise them as a safe way to manage pain. Eventually, clinics like Insight started emerging in Canada to try and combat the large number of overdoses and unsafe injections happening in Vancouver. People also sued pharmaceutical companies for trying to hide the addictive nature of opioids, and some companies eventually changed the formulas of their branded medications to try and make them less addictive. However, Canadians who are already addicted are still struggling to reach a healthy state.